Hello, my name is Dr. Robert Leahy, and I'm of the American Institute for Cognitive Therapy in New York City. Our website is cognitivetherapinyc.com. Today what I want to do is to talk with you a little bit about what is cognitive therapy. I want to speak with you about one of the most important developments in psychotherapy during the last 40 years, cognitive therapy. Cognitive therapy is a form of psychotherapy that emphasizes the role that your thoughts, or as we say, cognitions, play in making you depressed, anxious, or angry. This form of psychotherapy that we call cognitive therapy has been shown to be quite effective in helping reduce depression, anxiety, suicidal risk, and marital problems, and even has been helpful with patients who are on medication who are psychotic or have bipolar disorder. It's a very exciting form of psychotherapy, very effective. Now, cognitive therapy was first advanced by Dr. Aaron Beck of the University of Pennsylvania Medical School, and it's been developed over the past 40 years. There are countless studies that show that cognitive therapy is as effective as medication in the treatment of depression and anxiety. And when people finish their work in cognitive therapy, they are more likely to remain better than people who just simply have medication and who discontinue their medication. So cognitive therapy works and it provides lasting effects. The research shows that it's very effective. I want to give you some ideas of what this kind of therapy is today, what we do. Now, cognitive therapy focuses on your current thoughts. It's what you're thinking right now, not what happened to you when you were 5 years old. The way we think affects the way we feel. For example, if you think differently, you'll feel better. And if you act differently, you'll also feel better. So cognitive therapy is about thinking and acting in more effective ways, about changing the way you think and the way you act. For example, let's look at how your thinking affects the way you feel. Imagine you're walking along a dark street at night and you hear two men coming up from behind you. Your thought might be, these are criminals who are going to attack me. You feel afraid and you try to cross the street to get away. Your thought was, these are criminals. But imagine if you had a different thought. Imagine if you thought, these are a couple of nice people coming home after their dinner. With this thought, you feel relaxed and you just keep on walking. So your thoughts affect the way you feel. But your thoughts can be either right or wrong. The only way that we can know is to get the evidence. You have to test your thoughts against the facts. Cognitive therapy helps you identify your negative thoughts, test them out against reality, and develop more effective ways of thinking and acting. When we are depressed, our thinking focuses on the negatives, sometimes to the exclusion of any positives. We tend to have a biased or distorted way to think about things. Depressed people have a negative view of themselves, their future, and their current experiences. We call this negative view of self, future, and current experience the negative triad. When you have a negative view of yourself, you think of yourself as a failure, you feel unattractive or unlovable, and you don't give yourself credit for anything positive. When you have a negative view of the future, you predict that all kinds of negative things will happen. You engage in fortune telling. You think you will fail the exam, you'll get rejected, or that you'll be unhappy forever. And when you have a negative view of the current experience, you think that what is going on is boring, meaningless, and almost unbearable. You can't stand what's going on, and at times you think it has absolutely no value. So the negative triad is a negative view of self, failure, and current experience. This is how people think when they're depressed. When we are in this depressed state, we have certain distortions in our thinking. We call these automatic thoughts. Now, these automatic thoughts are thoughts that come to us spontaneously. They seem plausible, and we think that they're true. Some examples of automatic thought distortions are the following. Fortune telling. For example, you predict the future will be bad, even if you have very little evidence. I'll make a fool of myself, you say to yourself, or I'll fail the exam, or I'll be alone forever. Or labeling. You label yourself as having flaws and defects. It's like your entire self is the mistake or the flaw. I am a fool. or I'm ugly, or I'm a loser. Discounting the positives. When you discount the positives, you don't give yourself any credit for anything positive because you treat your positives as unimportant. The only thing that counts in your mind is the negative. For example, passing the test doesn't mean anything. It was easy. Anybody could do that. Or you might use all or nothing thinking. For example, you look at things in a black and white way rather than recognizing how complex things really are, that there are shades of gray. For example, you say, it was a complete waste of time. Or you might have catastrophic thinking. That is, you view events as awful and unbearable rather than as inconvenient or simply unpleasant. For example, you say to yourself, my life is ruined. Or you might personalize things. You think that everything is your fault. For example, you might say to yourself about a relationship, I must have messed up the entire relationship. It's all my fault. For example, think about a woman going through a breakup in a relationship and how she had the following thoughts. I'll never be happy again. This is fortune telling. Or she thinks, I must be unlovable. Who could ever want me? Again, she's labeling herself. Or she thinks, I know my friends think I have a lot going for me, but my partner rejected me. Here she's discounting her positives. Or she says to herself, nothing I do works out. And she's engaging in all or nothing thinking. She doesn't see anything positive. Or she says to herself, it's absolutely awful to be on my own. For her, being single is absolutely terrible. It's a catastrophe. She can't see anything positive coming from it. Now, these automatic thoughts can be very powerful. You may believe every one of them. You may believe that you will always be alone, that you are a loser, or that nothing you do will work out. But you have to keep in mind that thoughts are not the same thing as reality. Thoughts are our guesses about reality. We can only know what reality really is by collecting the facts. And that's where cognitive therapy comes in. Cognitive therapy helps you do this.